This is cervical vertebra 7 and thoracic 12. Tell me about the curvatures. 5 lumbar, 5 sacral, and so 7 cervical, 12 thoracic, 5 lumbar, 5 sacral, and how many coccyx? Coccyx varies. Somebody will have a long tail, somebody will have a short tail, but usually 4. 4, yes. What is the total number? Total number you want? 5 plus 5, 10. 10 plus 4, 10 plus 4, 14. 14 plus 12, 16, 26, and 7, 33. So 33 vertebra we have? Yes. Now if you have 33 vertebra, how many pair of spinal nerves you have? How many pair of spinal nerves? Yes. I think 31 pair of spinal nerves. Yes, correct. 31 pair of spinal nerves. How many cervical? I think 8. Yes, correct. Vertebra are 7, but nerves are 8. Thoracic 12, I think. Yes. Lumbar 5, I think. Yes. Sacral 5, I think. Yes. Coccygeal. Coccygeal is again depending upon how many. What is the length of your tail? It depends upon that. So 8 plus 12, 20. Yes. 5 plus 5, 10. Yes. 20 plus 10. I think 30 already. So coccygeal 1 only. Yes. Generally 1. Only 1 nerve here. Yes, coccygeal 1. That's all. So coccygeal 1, lumbar 5, sacral 5, thoracic 12, cervical 8. Yes, but vertebra 7. Yes. Then there will be some disproportionate things. Yeah, there are. That is what we have to discuss. Because vertebra are 7 and nerves are 8. Okay, what about the curvatures? You were talking about some curvatures. Yeah, curvatures, let us see. There are some primary curvatures which are fetal curvatures, and there are some secondary curvatures which are acquired after birth. So who is the fetal curvature? You know, fetus was universal attitude of flexion. What is that? There is the head of the baby and the tail of the baby. Universal attitude of flexion. Baby is, all joints are flexed. Inside the uterus, yes. Or universal attitude of flexion. All joints are flexed. Wrist is flexed, finger flexed, and the elbow flexed, shoulder flexed, and the head flexed. Everything flexed? Yes. And they are fetal curvatures. Who is fetal curvature? They are 1 degree primary curvature. Yeah, who is 1 degree primary curvature? I'll tell you. Thoracic to keep the thoracic viscera, and the sacral to keep the pelvic viscera. So sacral to keep the pelvic viscera is primary. Yes. And thoracic to keep the thoracic viscera is primary. Yes. Concave anteriorly? Yes, concave anteriorly and convex posteriorly. Convex posteriorly means kyphosis. Yes, kyphosis. There is a thoracic kyphosis and there is a sacral kyphosis. This is normal. So normally we have 2 kyphosis. Yes, primary curvatures. Since birth we have. So these are since birth, fetal curvatures. Yes. Then what happens after birth? You get secondary curvatures. Why do I get that? You are a baby now holding the neck, and that is the time we will have a cervical lordosis. So holding neck means 2 months of age after birth. Yes, 2 months of age after birth you will start holding neck and cervical lordosis will come, and by some 1 year you will have lumbar lordosis. Why there is lumbar lordosis? What is lordosis? Lordosis means anterior convexity. Anterior convexity. That is lumbar lordosis. Cervical lordosis, lumbar lordosis. Acquired curvature, secondary curvature. Why will I acquire it? You are standing. Actually, you are sitting, standing, and walking. So when I'm sitting, standing, walking, then I will develop the lumbar lordosis. Yes. I'll show you a diagram and then you understand. But remember, lordosis is secondary or acquired curvatures after birth, and the kyphosis are fetal curvatures, primary curvatures already present there. So this is what? This is some X-ray you have taken. Not X-ray exactly. Some CT scan, MRI you have taken. So you are telling that this neck region is due to neck holding. Yes. Okay. And this lumbar lordosis came because you were sitting, standing and walking. Yes. This is secondary curvatures. Yes, they are. Okay. What else? You see, when a baby is in mother, then universal attitude of flexion. So now the baby is born and there is some cervical lordosis and lumbar lordosis also. Oh, sitting and holding neck lordosis. Yes, this is lumbar lordosis, standing, and this is cervical lordosis, moving the neck region. So you're telling that cervical lordosis and lumbar lordosis is acquired. Yes. And thoracic and sacral were already there. Yes. Now this lady has become pregnant and center of gravity has moved anterior. What will happen? What happened? This lady became pregnant and there's a baby anterior. So center of gravity is anterior. Tell me what will happen. During pregnancy, yes, tell me what will happen. Oh, there is a baby which is shifting the center of gravity anterior. I think exaggerated lumbar lordosis. Yes. Pregnancy, exaggerated lumbar lordosis. That's why they walk like this, you know, holding the term pregnancy. Yeah, maybe term pregnancy, they walk like that. Okay, center of gravity going anterior. That's why lumbar lordosis, exaggerated lumbar lordosis. Yeah, that's what. What is the answer to this question? What is this? Slip disc. Why? What happened? Why there is a slip disc? No, there is a patient now, not the pregnant lady, some other patient. So disc herniation between L4-5. Yes. Tell me what is the answer. I'll give you a trick here. Remember one thing very clearly. It's a very beautiful trick. Beautiful. Yes, beautiful. How? Because it works quite well. Or something which works quite well is beautiful. Of course. Okay, what is the trick then? Whenever examiner will give you the slip disc, go to the upper vertebra and add +1, and that nerve is involved. Means 2 vertebrae are given, and go to the upper vertebra number and add +1, means L4 +1 L5. L5 is the answer you are telling? Yes, it's a trick. And it will work all the time. You know, slip discs are usually cervical and lumbosacral. So it will work. In the cervical slip disc and lumbosacral slip disc, it will work. What is the trick? Trick is, wherever the slip disc is given, go to the upper vertebra, add +1, and that nerve is involved. You mean to say L4 +1 L5. L5 nerve is involved. Yes, L5 nerve is involved. Can we discuss some other levels? Yeah, we'll discuss. But remember one thing. Cervical region, the spinal nerves are going above the respective vertebra. Means it is C1 spinal nerve. It will be above the C1 vertebra. So you're telling that each spinal nerve will go superior to the corresponding vertebra? Yes, that is the point. Each spinal nerve is going superior to the corresponding vertebra. If it is C1 vertebra, the nerve will go above C1. But this will change in the cervicothoracic region. Why it will change in cervicothoracic region? Because, you know, vertebra are 7, but the nerves are 8. So there will be a change. What change will be there? Now, after that cervical thoracic region, if this is the T1 vertebra, each spinal nerve will start going under the respective vertebra. Why under the respective vertebra? Because I'll show you a diagram, then you'll understand. So you're telling that in the cervical region, each spinal nerve was passing above the corresponding vertebra, like C1 spinal cord above C1 vertebra. Yes, but after cervicothoracic boundary, each spinal nerve will start passing under the respective vertebra. Yes, if you have T1 vertebra here, T1 spinal nerve is passing below, under the T1 vertebra. And what about the lower level. It will happen the same way. If it is L1 vertebra, L1 nerve is here, and same way continues throughout. Yes, understand. In the cervical region, the nerves are short and straight. Short and straight. You mean to say spinal nerves? Yes. Can you see them? Short and straight. But in the lumbosacral region, they become long and oblique. Long and oblique. So you are telling that here in the cervical region, the cervical nerves are short and straight. Yes, but gradually they become long and oblique. Why they become long and oblique? Because you know, what is the length of vertebral column? 60 centimeter. What is the length of spinal cord? It is 45 centimeter. Where is spinal cord terminating in adult? L1 lower border. So you can understand that the fiber must become long and more oblique because they have to exit at their corresponding intervertebral foramen. So they have to exit at corresponding intervertebral foramen. That is why they are long and more oblique. What is the importance of knowing that? Importance is, if there is a slip disc in the cervical region, same nerve exiting will be involved. And what if it is lumbosacral region? Then the same nerve may not be involved. Then who will be involved? That is what we will find out, that who will be involved, because in the cervical region they are short and straight. Maybe the same nerve exiting the region will be involved, but here the nerve exiting at the same level will not be involved. The next nerves will be involved. Next nerves will be involved. Which next nerve will be involved? Can you tell me? I'll tell you. See, this is C5 vertebra, 6, 7, 8 vertebra, and T1. There's a change now. What? What is the change? I told you, in the cervical region, each nerve was going above corresponding vertebra. Means which nerve was this? This must be C5. Why? Because there's C5 vertebra. So because this is C5 vertebra, the corresponding nerve should be above the vertebra. Yes. Means this is C6 vertebra, so nerve is C6 there. Yes. And the C7 vertebra, so C7 nerve is above that. Yes. But now see the change. Because there is a C8 nerve, it has to pass under C7 vertebra. There's a change now. There's an additional nerve. And because there's additional nerve, there is no C8 vertebra. So C8 nerve should pass under the C7 vertebra. This is C7 vertebra. What is passing above that? Above that must be C7 root. Yes. And below that, C8. Yes. After that, what happens is, each corresponding spinal nerve passes under the corresponding vertebra. Means if it is thoracic one, then the nerve will be under the vertebra. So in cervical region, all the nerves are above the corresponding vertebra. Yes. But thoracic downward, it is each nerve below the corresponding vertebra. Yes. Now, as you say so, you will find this is lumbosacral region, and the fibers have become long and oblique. So here they have become long and oblique. Yes. And we have got one diagram to discuss. Understand, as I told you, if it is L3 vertebra, L3 nerve is passing under that. If it is L5 vertebra, this L5 nerve is passing under that. If it is S1 vertebra, then S1 nerve is passing under each corresponding vertebra below the thoracic region. So what is the what do you want to discuss here? See, I have a slip disc at L4 and L5 vertebra level. So tell me which nerve is involved. You got a slip disc in L4-5 vertebra? Yes. L4-5 vertebra actually. So you are telling that this is L4 vertebra and L5 vertebra. Yes. Tell me which nerve is involved. Actually, I think this is L4 root value passing under L4 vertebra. Yeah, that is what is happening, but it is not involved. Why it is not involved? The nerve exiting at the same level is not involved. Why? Because this is a posterolateral herniation. So, nucleus pulposus, posterolateral herniation, that is more commonly seen. Yeah, okay, fine. So, same nerve is not involved, exiting the level? No, next nerve is involved, plus 1. Plus 1 means L4 plus 1. L5 nerve is involved? Yes. Similarly, when there is a posterolateral herniation of the nucleus pulposus at the L5-S1 vertebra, L5-S1 vertebra. So this is L5-S1 vertebra now. Yes. So there is a slip disc in L5-S1. Yes. Which nerve is involved? The nerve which is exiting at the level, or the nerve which is one segment below. So the nerve exiting at the same level is not involved, but the next nerve is involved, which is S1. The next nerve is involved. +1 nerve is involved. Okay, fine. Again, this question? Yes. Tell me what is the answer. L45. Yes. See, that is why I gave you a trick, and the trick works all the time. What was the trick? I forgot. You forgot. I told you wherever the slip discs are given, go to the upper vertebra, add +1. That nerve is involved. L4 +1, L5. L5 was the answer? Yes. L5 was the answer. Can I use this trick at other levels now? Yeah, let's do that. This is C4, C5 slip disc. Tell me which nerve will be involved. C4 is upper vertebra +1, C5? Yes, +1, +1, +1, +1, +1, +1. But sir, L5 +1 is L6. Yeah, it is L6, but do you have any L6 root value? It is the next nerve. +1 means next nerve. Oh, +1 means next nerve. There is no L6? No. L5 +1 is L6, of course, but there is no L6 nerve. +1 means the next nerve. So C4 +1, C5 involved. Yes. +1, +1. Yeah, that's good. Let us write it down ourselves by drawing a diagram. This diagram, what is this? So upper limb, lower limb, slip disc injuries. Upper limb, lower limb, slip disc injury. Why? What is happening? Let us draw and discuss. What are we drawing? The lumbar. The first is cervical thoracic and then lumbosacral vertebra. What vertebra? First it is cervical thoracic. Which cervical thoracic? C6, 7 and T1. This is cervical thoracic. And then which vertebra? It is lumbosacral. Which one? L4, 5, S1. Oh, lumbosacral. Why have you drawn this? Because slip disc is usually here. Where is slip disc? Usually it is cervical or lumbosacral. Actually, lumbosacral 90% cases and cervical 10% cases. So you're telling that slip disc is mostly happening lumbosacral region 90% of the cases, clinical cases? Yes, evidence-based medicine. And cervical 10% cases? Yes, cervical 10% cases. Okay, how many thoracic? Thoracic, rare. Thoracic is rare. Thoracic slip disc is rare. Okay, fine. Then can you tell me about the nerves, how the nerves were exiting? Nerves, each vertebra above that. This is C6 nerve. So this must be C7? Yeah, that is C7 nerve. And this must be the T1 nerve. T1, C8 nerve? Yes, C8 nerve. So these are the spinal nerves we are showing here. Yes, spinal nerves. And there's a vertebral level. Yeah, that is vertebral level. So you are telling that each nerve exit above the corresponding vertebra. C6 nerve above C6 vertebra. Yes. C7 above C7 vertebra. Yes. What about the T1 then? Now there's a change. Each nerve starts passing under the corresponding vertebra. So you tell me who will be here? Under L4? Yes. Must be L4 nerve? Correct. What is under L5? L5 nerve? Yeah, correct. Under S1, I think S1 nerve? Yes, correct. But remember, there is a difference in the cervical region and thoracic, this lumbosacral region. So because of that difference of the nerves, because here they are short and straight and they are long and oblique, different type of nerves will be involved. So it may be difficult for you to remember. I'm just giving you a trick. Use the trick. Trick means what is the question? Question is simple. I'm asking. There's a slip disc between C6 and 7 vertebra. Which nerve involved? Slip disc between C6, 7. Should I use the anatomy thing or trick? Use the trick. You're telling that whenever there is a slip disc given between C6, 7, whatever, I go to the upper vertebra, add +1, C6 +1 means C7 nerve involved? Yes, correct. Okay, then here I think C7 plus 1, C8 nerve involved. Yes, slip disc. This is the slip disc cases. Okay, then here L4 plus 1, L5 nerve involved. Upper vertebral plus 1. Yes, correct. Then here it is L5 plus 1, L6 nerve involved. L6. There is no L6. Next nerve. Plus 1 means next nerve. Or means S1 nerve involved. Yes. Like that, use the trick. Don't use anatomy here. Just use the trick. Okay, so trick tells wherever the slip disc is given, upper vertebra plus 1 root value involved. Yes. Upper vertebra plus 1 root value involved. Yes. Upper vertebra plus 1 nerve is involved. Yes. Upper vertebra plus 1 nerve is involved. Yes. Which cases are these? This is lower limb cases. This is upper limb cases. Can we see upper limb, lower limb cases now? Yes, let us see. This is lower limb case, lumbosacral root value. This is upper limb case, cervicothoracic. Yeah, which patient has come? This patient is telling, I have burning sensation in the middle finger. Actually, middle 3 fingers are C7 dermatome. So C7 nerve involved. This patient came to you telling, I have burning sensation in the middle finger. So you're telling C7 dermatome involved. Now you're checking the myotome. What? Triceps reflex? Yes, triceps. So as you're checking the triceps reflex, the triceps reflex is weak. C7 myotome. Yes. Okay. C7 myotome and C7 dermatome. I think I know the slip disc. Yeah, tell me where. Tell me where. You have taught us some trick. I'll use the trick. Yeah, use the trick. The nerve involved is C7. Tell me, where is the slip disc? Where will you focus your MRI now? Use the trick. You remember? C6 and C7. Upper vertebra plus 1 nerve is involved. Upper vertebra plus 1 nerve is involved. So I will focus my MRI here. Some slip disc is there. Yes, some slip disc is there. See, there was a slip disc between C6-7 and C7 root value involved, and the dermatome is middle finger, and myotome is the triceps, and the triceps reflex is down. Extension is compromised. C7 is basically root value of the radial nerve for elbow extension, wrist extension, finger extension. So it is radial nerve C7 for elbow extension, wrist extension, finger extension. Yes, remember that. Okay, fine. What about the lower limb? You told there's some lower limb case. Yeah, lower limb case has come. They are telling, I have burning sensation little toe. Burning sensation little toe. And you know little toe is S1 dermatome, S1. So little toe is S1 dermatome? Yes. Now you check the S1 myotome. How do you check the S1 myotome? I'll take a knee hammer and hit here. Where? Ankle reflex, tendo Achilles. And what do you want? I should find some plantar flexion. Is it happening? No, it is not happening. Why it is not happening? Because it is the S1 root injury. So S1 root injury, ankle reflex is gone, plantar flexion is gone. Yes. And the little finger, little toe, and lateral margin is having some burning sensation. Yes, little toe and lateral margin of the foot is having S1 dermatome, is having some burning sensation. Tell me, where is the slip disc? Use the trick. Use the trick. S1, yes. Sir, I think it is... yes, you are correct. Whichever is the upper vertebra L5, the next nerve will be involved. L5S1? Yes. It is a case of L5S1. So now if L5S1 is involved, that is where I put my MRI focus. Yeah, you will put your MRI focus posterolateral herniation of nucleus pulposus, compressing the next coming nerve. So heel and little toe is S1 dermatome. Yes, it is. And what is this? Sole muscle. Soleus. Soleus is calf muscle for plantar flexion. Calf muscle for plantar flexion, soleus muscle. Okay. You are talking about ankle jerk. Yes. Remember, it is ankle jerk. Hitting the tendon of tendo Achilles for plantar flexion. Which nerve is that? Tibial nerve. nerve of the calf region. Tibial nerve is a nerve of calf region for what? For flexion, plantar flexion. It's not working now. Yeah, that root value is not working. Which one? S1. Okay, fine. So it's a simple trick now. Yes, actually, I'm telling you, cervical slip disc are there and lumbosacral are there. So use the trick. It's a very simple trick. Upper value plus 1, root value involved. Upper value plus 1, upper value plus 1, upper value plus 1, upper value plus 1, upper value plus 1. The next nerve is involved. It's a simple trick. If you start discussing anatomy there, then it might take time. In exam, you don't have time. You have to quickly get your answer. So tricks work sometimes good. And if you have tricks after concepts, then it is stronger. If you just mug up the trick, then there might be problem. But if your concepts are good and then you have tricks, then it is better.